Welcome to Lesson 5, Preventing Diabetes Complications. When you complete this lesson, you will learn the following. The many complications that can result from uncontrolled diabetes, including stroke, blindness, heart disease, kidney disease, and impotence or sexual dysfunction. Important preventative health screening tests. Protective actions you can do to prevent complications. Lifestyle changes to improve your health. Now let's talk about the health complications from uncontrolled diabetes. Diabetes is considered uncontrolled if your A1C is above 8%. People who have uncontrolled diabetes can have the following complications. Heart disease. The combination of high blood pressure and high blood sugar can result in a heart attack or stroke. Eye problems and blindness. Uncontrolled diabetes can damage the small blood vessels in the eyes or retina. This condition is called diabetic retinopathy, which can lead to blindness. Uncontrolled diabetes also increases the risk of developing other eye problems like glaucoma. Kidney disease. Kidneys are organs that work like filters to remove waste products from the blood. High blood sugar can damage the kidneys, resulting in kidney disease or kidney failure. Infections. Sugar is bacteria's favorite food. High blood sugar allows bacteria to grow and infections develop. Uncontrolled diabetes can weaken the body's ability to fight infection. Nerve damage. Called diabetic neuropathy, tingling or pain in the hands and feet is the result of high blood sugar. Neuropathy is dangerous because a minor foot injury may not be felt until it becomes infected. If the infection moves to the bone, the foot may have to be amputated. Impotence or erectile dysfunction. Nerve damage can affect the ability to get or maintain an erection. Erectile dysfunction, or ED, results from damage to nerves and blood vessels caused by poor long-term blood sugar control. It is important to discuss any ED symptoms with a doctor. Dental problems. Periodontal disease is an infection that occurs when the gums pull away from the teeth, creating deep pockets that harbor bacteria. According to Men's Health magazine, men with erectile dysfunction, or ED, were 79% more likely to have been diagnosed with periodontal disease. In other words, the majority of men with ED also have gum disease. Now that we understand the complications from uncontrolled diabetes, let's talk about preventative health screenings, which should be part of your annual physical exam. Preventative health screenings include fasting lab tests. Remember, no food or beverages other than water for 8 hours prior to having blood drawn. ABCs to protect your heart and blood vessels. A is for A1C. As we discussed in Lesson 2, your A1C test should be 7%. B is for blood pressure. According to the American Heart Association, blood pressure should be below 130/80 for people with diabetes. C is for cholesterol. Good cholesterol, or HDL, should be above 40 for men and above 50 for women. Bad cholesterol, or LDL, should be below 100. Triglycerides, or fats, should be less than 150. S is for stop smoking. Diabetic smokers have higher risks for complications than non-smokers. Kidney function tests. Your doctor will order lab tests to make sure your kidneys are functioning properly. Diabetes is the leading cause of kidney failure and need for dialysis in the U.S. A urine microalbumin test will determine if there is any protein in the urine, an indicator of early kidney damage. Kidney damage, or worsening kidney damage, can be prevented by excellent blood sugar and blood pressure control through diet and medication. Foot exam. Your doctor should examine your feet at every appointment. Doctors use monofilament to test for loss of sensation and foot pulses. Eye exam. Uncontrolled diabetes can cause blurred vision or blindness. An eye doctor can catch problems early if you get a dilated eye exam every year. Flu shot. You should get a flu shot every flu season, especially if your diabetes is uncontrolled. Remember, a simple flu can turn into an infection or pneumonia quickly with high blood sugar. Pneumonia shot. Every diabetic should receive a pneumonia shot. Preventative self-care. If diabetes is not in good control, there are many things that can be done to reduce the risk of complications. Self-foot exam. There are 73,000 diabetes-related amputations in the U.S. every year, 200 per day or 8 per hour. It is important that all diabetics examine their feet daily after bathing. Look at your bare feet for red spots, cuts, swelling, and blisters. Use a mirror if you cannot see the bottoms of your feet. Self-foot exams should include the following. Wash your feet and dry them, especially between the toes. Lotion your feet, not between your toes. Trim your toenails. Always trim straight across the toenail or see a foot doctor, podiatrist, to trim your toenails. Wear shoes and socks at all times. Never walk barefoot. Wear comfortable shoes. Make sure the lining is smooth and there are no objects inside the shoes. Make sure blood is circulating in your feet. Put your feet up when sitting. Wiggle your toes and move your ankles up and down for 5 minutes, 2 or 3 times a day. Educate yourself. Take ownership of your health and learn more about how to self-manage your diabetes. Meet with a registered dietitian or nutritionist online or in person to learn more about healthy eating. Ask your doctor or endocrinologist to refer you to a certified diabetes educator or CDE for additional education about managing your diabetes. Go to the American Diabetes Association, diabetes.org, and American Heart Association, heart.org websites to learn more about how to improve your lifestyle to become more healthy. Learn about your medications. Take all medications as prescribed by your doctor. If you have questions or concerns about your medications, ask your pharmacist or the prescribing doctor. Educate yourself about the prescription and over-the-counter medications that you are taking. Medication side effects and interactions. Some medications have side effects or may interact with another medication that you are taking. Use Medscape Drug Interaction Checker to determine if any of your prescription of over-the-counter medications have interactions. If you have concerns, discuss with your doctor or pharmacist. Commit to making lifestyle changes, including increase activity, healthy eating, reducing sugar and fried foods from the diet. Stop smoking. Reduce alcohol consumption. Let's summarize what we have learned about preventing diabetes complications. We now know the complications from uncontrolled diabetes include stroke, blindness, heart disease, kidney disease, and impotence or sexual dysfunction. Important preventative health screening tests that should be done annually. Protective actions you can do to prevent complications. Lifestyle changes to improve your health.